Hello. June is actually Scoliosis Awareness Month, so we want to talk about that real briefly with you about what scoliosis is. Now, when we look at your spine, from the front, we should be in a straight line. So when we look at your spine, it should be in a nice straight line when we look at it from the front. But a scoliosis means that there's a curve in your spine, and more likely something more like this. This is what they're going to call a scoliosis, where there's this curve in there like this instead of being that straight line. Now the problem is your spinal cord goes through the back of your spine here and comes out in these nerve roots. But as your spine shifts off like this, it's putting pressure on the spinal cord and those nerve roots, and it affects how the body works. Plus your structure and your balance is off, so then the muscles are tightened up. So it creates lots of other problems, especially down the line. So if you do have scoliosis, you want to do something about it immediately. Start getting that treated immediately. But for most people, do not have scoliosis, but they may have what's called a subluxation, which is a precursor to that in some ways, and it's just a lesser version of a scoliosis. Or maybe you have a shift like this, which is not a scoliosis, but you can see definitely not in a straight line. So this is exactly what we work with as chiropractors, is removing that interference, helping realign that spine as a corrective care chiropractor. So we want your spine to be completely straight when we look at it from the front, but when we look at it from the side, we need to have 3 curves in here for your body to function and heal at 100%. So when we look for that scoliosis, we want to make sure that your spine is not bent to the side. We want to make sure you're straight. So what's one of the portion of our exam that we do is making sure that your spine is in a straight place. And if it's not, we want to know about that. And we want to start taking action on it now and not letting it continually to get worse and compromising your nervous system and your function throughout the rest of your life. So that is Scoliosis Awareness Month here in June.